medication in treatment.
No.
Toxicology is the study of poisons and everything that has to do with the poisons on the human body. Therapeutics is the science of treating a disease.
Should be a binder that's on top of everything.
Therapy.
Just
treatment. That kind of corresponds, right? Figure out a way, whatever's going to work best for you. Toxic poison, I think, is pretty obvious, right? Therapy, treatment, pretty obvious. Pharmacodynamics. Dynamics, actions, right?
One thing I struggle with is posology and toxicology, because posology, you think it's poison, but it's not.
Right?
No.
Yep.
You'll know when it's
toxic
super
is
when
poison.
you open up the first
So just
page.
like
You're going to see
pose of the dose,
the
like,
course of
you have
gas.
to peel it,
Post and
then
dose.
peel it, right?
Post and dose.
Flip it.
All right, the Remington, that is your blue Bible that was on my Chiefs exam. And it's been on a lot of my exams.
So
It is the science and practice of pharmacy, and we
Flip
use
the
the most
page.
widely used text reference, and that was
And
the
then you're
question.
gonna keep
What
going
is
until
the
you
most
see
widely used text
the
reference for
instructor
pharmacology
sign
or for
offs.
pharmacy?
Last time I saw this question, they had the PDR on it too.
Mhm.
Yep.
Well, yeah, the physician's text
So
reference will be on there too. That's not
there's
just
one that's for
pharmacy.
ASM and one for
That's for
CLS.
physicians,
Can you get
for
me
them
the
to use. What is the
pictures
most
of them, the
commonly
dates of
used
everybody?
inside
That's
the
what senior
pharmacy for
needs.
pharmacists, not for
The dates everybody's
Yes,
been trained
the
and
They
when
don't
it
like
expires.
Marlins, they don't like Henrys, they like Remington.
Blue Bible Remingtons. This one was on my test. Minimum dose is
I can
the
write expiration
least
dates. It's going to
amount
be whatever
required
year mark
or
from
least
the
amount that you can
date
give
we wrote qualified.
to treat
See what I'm coming for there?
that has a therapeutic effect. Maximum dose is
Oh.
the largest amount that you can give without achieving a toxic effect.
Yes, please.
Your toxic dose, you give them so much that they are now exhibiting signs of poison. Therapeutic dose is your normal adult dose. That is where we strive to stay to get rid of usually infection or pain or whatever it is. So that's why you have take 800 milligrams of Motrin twice a day for 7 days. Because if you take it once a day, you are not going to achieve the therapeutic effect that you want to achieve. The pain is going to come back in between, and you're not going to maintain that level of homeostasis that you want to achieve. Minimum lethal dose, that is the gram at which, or the level at which you cause death. Like the very first, so I add 1 extra gram or 1 extra microgram onto the scale and give it to this patient, the patient dies. That's your minimum lethal dose. Okay, oh, I didn't have everybody grab these. This one has rams. Take one pass down. All right, so we just covered all of these. The science of treating a disease is what? Therapeutics. Yes, science of treating a disease is therapeutics. The study of the action or effects of medications on living organisms. So the action or effects.
Pharmacodynamics.
Pharmacodynamics. Blue Bible of Pharmacology.
Remington.
Remingtons. Science dealing with the origin, nature, chemistry, effects, and uses of medications. That is pharmacology. Study of poisons. Toxicology. Study of dosages.
Posology.
Posology or posology.
You got this dosage right? I'm positive.
I'm positive. All right, so now we have a math lesson. Everybody have a pen and a piece of paper or a calculator, because we're going to talk about it and then we're going to do one.
That's young.
So age is the Young's rule. So if you are determining dosage based on age, it is the Young's rule. It is the most common factor used to determine dosage, is the patient's age.
That was on the test.
It is always on the test.
I had wrong.
Age in years divided by age in years plus 12 times adult dose. So they're going to give you the adult dose, they're going to give you the patient's age, and they're going to tell you figure out what the child dosage is. Know this calculation when you get your scratch piece of paper and you sit down at your table and they say go, write that down. And the next one I give you. But first, we are going to do a calculation. Everybody ready?
Sure.
The adult dose of aspirin is 650 milligrams. What is the dose for a 3-year-old child? So what's the first part of this equation?
5.
So age of the patient is 3.
Oh.
So not 5, 3. What's the next part of that equation? So divided by 15, because it's 3 plus 12, right? So do that part first,
Which is 5.
which is 5. Then what are we doing?
130 milligrams.
Multiplying it by 650 milligrams. Slow down, you guys. Don't jump ahead and give answers to the next question. Because not everybody knows how to do math equations like this, right? Theoretically, not everybody knows how to do them. So you do what's inside the parentheses first. So you have to add before you divide. So not to insult anybody's intelligence, but I want to make sure that there's nobody lost, right? So you add here, then you divide these two numbers, then you multiply it by the adult dose. The adult dose is 650 milligrams. So we have 3 divided by 15, because 3 plus 12 is 15. So 3 divided by 15 times 650, and what's our answer?
130 milligrams.
130 milligrams. Did everybody get that answer? Fabulous. Our next one is weight. This is called Clark's rule. Figuring out a child dosage based on weight, or even an adult dose, because sometimes adults are like 65 pounds, okay? So weight, and in that case, we don't give them an adult dose of medication, right? You okay? Okay, so weight is Clark's rule. That is weight in pounds divided by 150 multiplied by the adult dose. Everybody got this down? The adult dose is 650 milligrams of aspirin. Did you get it? You're good. Are you good?
I got
Weight in pounds divided by 150 multiplied by the adult dose. Clark's rule. Yes.
I got the answer.
Okay, hang on. Again, let's get us through it, okay? I can do math quickly too, but not everybody
Yeah, do
can.
they give us calculators on test?
No, they do not. You get a scratch piece of paper and a pencil, learn how to do math on paper. That's why you need to know the equation, and you need to be able to write it down, and that's why when I tell you you need to know how to do the math inside parentheses, it's because if you don't remember how to do the equations, we're going through that now.
Hint, this is the exact same math question that has been on the exam for
Yeah.
pharmacy. I've only seen this question way back when I took HM3 exams, but this is the exact question, the only question I've ever seen.
Yes.
So if you study the answer to this,
So your
you'll
child
probably
is
be good to go.
60 pounds. So going back to our equation, what's the first number you write in the equation? 60. What's the second number you write in the equation?
Caught up doing some semio stuff. We have these.
150, right? Because it's already given to you. And then we're multiplying that number by 650. So 60
Is this the overall? Yes, that's the overall.
divided by 150 is what?
The one. I guess we could just do
Okay.
it for today. Or whatever you think. is
Multiplied by
best. We could try to make some more copies.
650 is
I
what?
would try to have like each day. Okay. Does that make sense? So that we can- how many
260
people-
milligrams, absolutely. No, both of those equations, they like to use at least one of them
Thanks,
on every
22.
exam.
You got 22 pounds?
This may be a good question.
No, yeah.
for both of them, should young people and commercial be taking the same doses per patient?
They should if they corresponded to the same patient.
Okay, and how do you know which, like, rule you're supposed to use, just based off the data?
So the provider will tell you which one they want you to use, or the pharmacy will determine which one is the better one to use. Like I said, if you're calculating a child's dose for an adult patient, because that adult weighs 65 pounds, that is the better dosage, and typically the provider will tell you, we have to do a child's dose for this adult.
And for the exam, it'll give you weight versus age.
Yeah, and on the exam it will tell you, patient is 3 years old, or it will tell you, patient weighs 60 pounds, figure it out.
So to answer your question too, it's how the drug affects the body. So sometimes if it's going to affect somebody that's heavier, that's where they're going to take the weight rule, the Clark's rule more into consideration when they're doing it. So if you ever looked at your bottles of medicine, it'll either specify age or it'll specify weight because they want to know that the certain concentration is going to be safe for the individual that they're using it on.
Yeah, because you could have like a 10-year-old patient, right, who a 10-year-old's usually like 90-ish pounds, but you could have a 10-year-old that's 60 pounds. You don't want to give them the 10-year-old's dose if they're 30 pounds lighter than a normal 10-year-old. You know what I mean? Okay. Everybody good with this one? Other factors that are considered in dosing medication: sex, females, what's it called? I just lost the word. Metabolize. Thank you. Metabolize medications differently than men do. Race, occupation, habitual use, time of administration, empty stomach versus full stomach, frequency of administration, and mode of administration. IV is obviously going to have an effect a lot faster than oral. Suppository is going to have a faster effect than oral. Methods of medication administration. So oral, the most common, obviously. Sublingual means it's under the tongue. And buccal is between the cheek and gums. Parenteral medications, like subcutaneous, that's injected just below the skin. Intradermal, it's in the dermis layer.
Dermal complex.
You see this? Intramuscular, or IM, and that's, I mean, if any of you remember your immunization stuff, IM is in the muscle, IV is in the veins. Intrathecal or intraspinal is in your subarachnoid space. What's one of the most common ones that we talk about?
Epidural.
Epidurals. Epidurals for mamas that are giving babies to the world. Inhalation. What's one of the most common inhaled medications we give? Albuterol. So vaporization, it's liquid or solid to a gas. Gas inhalation for anesthesia purposes typically. And nebulization, which is that fine spray, which is an inhaler.
Also albuterol.
And it's also albuterol. Topical, it has a local effect, not a systemic effect. Systemic effect is in your bloodstream. Rectal, babies get Tylenol rectally. They cannot be given it orally, right? So, and vaginal. So there's like birth control and stuff that we, like NuvaRing is a vaginal medication.
Monostat.
Monostat is a vaginal medication. All right. Know your 6 rights of medication administration. This is a basic thing. Everybody should remember these from boot camp. I mean, not from boot camp, from course school. Right dose, right patient, right medication, right time, right documentation, and right route. Does anybody have a cool little ditty that you remember? Because I know y'all made up dirty ones.
I we just thought about like when you give the medication.
Okay. DPMTDR. Dose, patient, medication time, documentation, and route. Medication nomenclature, you have your chemical name. The chemical name relates to the chemical and molecular structure of the medication. I have 3 total for this. Okay. And you want to give one of her, please? Thanks. All right, your generic name is the common name of the medication. And then your brand name or trade name. So like acetaminophen is your generic name. Your brand name is Tylenol. And I can't tell you what the chemical name is for that because I don't remember. It's 450 degrees in this room. Jesus. Medication classes. Astringents. It shrinks the cells. An astringent pulls the fluid out of the cells and shrinks the cells. Emollients. Bland or fatty substances. These are like aquaphor. Expectorants, known as bronchomucotropic agents, and that's like Mucinex or Robitussin. Antitussives are the exact opposite of an expectorant, and it makes you not cough, like Tessalon pearls. Nasal decongestants are Sudafed, and that just reduces the congestion and the mucus in the sinuses. Antihistamines, Benadryl, a lot of other, all the allergy medications you can think of. Bless you. Histamine H2 receptors. You have your antagonist that blocks the histamines that causes an increase of gastric acid secretions in the stomach. That's your Prilosec. And then you have your antacids, and that's used to counteract hyperacidity in the stomach, like Tums and Rolaids. All right, so now we have some matching to do. So hopefully y'all listened to the last couple of slides. So what causes the shrinkage of the skin and the mucous membranes?
What's up to Jesus?
Astringents. What counteracts the hyperacidity in the stomach?
Uncle acid.
What is it? Antacids. What is bland fatty substances that are applied to the skin to make them more pliable and soft? Emollients. What suppresses the act of coughing? Antitussives. We want to suppress the cough. So tuss is to cough, and we are anti-cough. So antitussant. What assists in the removal of secretions or exudates from the trachea, bronchi, or lungs? Expectorants. That's what makes you cough. And what blocks histamines that cause increase of gastric and secretions in the stomach?
Oncohistamine.
What is it?
Oncohistamine.
Antagonists. It's the antagonists. Antiseptic, disinfectant, and germicide, primarily intended for the prevention of infections by destroying bacteria or preventing their growth. So, antiseptics, disinfectants, and germicides, we all deal with this in our spaces. We have Cavicide wipes and things like that, Lysol, whatever we're using at home, antiseptics for the skin, disinfectants and germicides are for surfaces, and an antiseptic just suppresses the growth of microorganisms. We are not trying to bioterrorize our skin. Okay, so an antiseptic is for skin because we're just suppressing the growth. A germicide kills any of the susceptible organisms to that product. So if I take a Cavicide wipe and I wipe this table over here, this table is non-porous, it is going to kill whatever bacteria is on the surface. And then you have a disinfectant. A disinfectant, when you disinfect inanimate objects, it generally has a germicidal effect, which means it tends to kill the germs that are on there. Some of them are antiviral as well and will kill the viruses. Sometimes it's just the act of wiping that takes them off. Like Clorox wipes are good, but they don't kill everything, right? 99.9% effective. because it doesn't kill everything, but it will take away any nutrient source and the bacteria will die naturally. And then you have sulfonamides. So these are antibiotics. Antibiotics, I could nerd out all day and tell you how they work and what they do and what part of the bacteria they take action on. That's way too in the weeds for y'all. But sulfonamides were the first effective chemotherapeutic agent. I would know. The first effective chemotherapeutic agent was a sulfonamide. Yep. They figured out how to use it in a safe therapeutic dose and make it effective in human beings. It is effective. It is a broad spectrum antibiotic, which means it kills gram-positive and gram-negative microorganisms or bacteria. Examples of that are Bactrim and Septra. So if you have a scenario-based question and they give you a list of drugs, and it's like this patient had, fecal matter leak into their stomach cavity because they botched the surgery. I mean, they don't say it like that, but it's essentially just, read between the lines. What are you going to treat with? Sulfonamides is a good choice. Bactrim, Septra, depending on how they word it on there, you want a broad spectrum antibiotic. Penicillins are derived from penicillium molds from bread or fruit. And that's like penicillin G, amoxicillin. Then you have cephalosporins. Your cephalosporins, there's a lot of groups of those. Semi-synthetic derivatives of cephalosporin C, and it's an antimicrobial agent of fungal origin. So because cephalosporins are so similar to penicillins, some patients that are allergic to penicillin are also allergic to cephalosporins. So if you have a concern, if your patient is like anaphylactically allergic to penicillin, the provider will typically not prescribe a cephalosporin either. And that's like your Ancef and your Keflex. Tetracyclines. These, they have the most important mechanism of action of the tetracyclines is the blocking of the formation of polypeptides. This is where I said we weren't going to get too in the weeds, but tetracyclines, what happens with bacteria is that when they reproduce, the polypeptide chains are what are reproducing. So as an organism starts to bud off another organism or grow a baby, it's the polypeptide chains that are duplicating or replicating to create that baby. And tetracyclines inhibit that action. So it inserts itself into the bacteria and stops the polypeptide chain reaction.
Look at he got trained shortly after
Bacterial
me,
birth
Leonard,
control.
and you and Williams got trained.
I like that.
Like a month or two after that.
And that's your doxycycline, minocycline. There's a million tetracyclines, but if it ends in lean or cycline, it's a tetra. All right, what was the first effective chemotherapeutic agent available in safe? Sulfonamides. Sulfonamides. If a patient has a penicillin allergy, what do we maybe want to consider not giving them?
Ancef and Keflex.
Ancef or Keflex, which is cephalosporins. Exactly. Aminoglycosides, they inhibit protein synthesis. So,
It's eye drops.
You said it's eye drops? Yeah, gentamicin and neomycin. So basically what happens is the protein structure that is in the cell of the bacteria, it doesn't kill the bacteria on contact, it just inhibits the proteins from forming together in order to reproduce. Macrolides, they're effective against gram-positive cocci. I would know erythromycin, vancomycin, and azithromycin. I would know vancomycin. And I would know vancomycin for Neisseria and Haemophilus. Those are two test questions I have seen on the exams. Gram-positive cocci, it's usually gram-positive diplococci, and it's Neisseria. Okay, and the medication that you use to treat it with is vancomycin. And I've never seen macrolides on the test, but I have seen vancomycin as the answer on the test. And I've seen gram-positive diplococci associated with Neisseria.
If you don't see it as Neisseria, it's gonorrhea.
Gonorrhea is gram-negative diplococci. Your gram-positive diplococci is your Neisseria. What's up?
So when you use, what is it, doxycycline for the other one you said, gonorrhea?
Yeah. Yeah, doxy for gonorrhea.
That's always on the test.
And
so
that's
no-
always on the test, and that is a gram-negative diplococci. So don't get your gram stains mixed up. Your gram-negative is the pink red. Diplococci is the two cocci circles. They look like butt cheeks because they're pressed together like this. Because when they replicate, they don't completely detach from each other. They replicate and they stay conjoined twins. Okay, or butt cheeks. They look like on the slide. Little pink butt cheeks. Or gram-positive cocci that are little purple butt cheeks. And that's Neisseria. Antifungals suppress the growth of fungi, shockingly enough. And that's like your Candida species, right? Like, so yeast infections, clotrimazole and miconazole, and what did you say earlier? Diflucan and stuff
I
like that.
didn't, but yeah, we could go that way.
Antifungals. Antiparasitics or anti-helminthics. Those are, again, anti-parasites. So like Flagyl and Burmox. I've seen Burmox on the test, and that's why it's in red.
Burmox means worm, so.
They're parasites. Anti-malarials prevent malaria. Primaquine. There's a few of them. There were a bunch on the test for us.
Yeah, they asked, it wasn't primaquine though, it was something else.
What's the other one that's really common?
It was like it was like which one is an anti-malarial, and then it was like a list of medications.
Malarone.
Malarone is another one.
That's what it
Thank
was.
you. All right, laxatives.
Hey, Joel, can you go back real quick? I'm sorry. I'm trying to go as fast as I can.
Take pictures, get the slides. You need all of this information.
I'm just writing down one thing that I wanted to put on here.
Okay. I have 3 minutes to finish this, and I'm not even halfway through, guys. So, laxatives. Medications that facilitate the passage and elimination of feces, like Dopalax, stuff like that. I've never seen it. Diuretics. I have seen diuretics on there dealing with urine output. So,
Chlorothiazide?
yeah, hydrochlorothiazide and Lasix. Non-narcotic analgesics relieve pain without producing unconsciousness. That's your, like, Tylenol, right? Antipyretics is also Tylenol because antipyretic is anti-fever. Anti-inflammatory, that's your Motrin. And Mobic. Not Mobic, what's the other one? Sorry. I just lost it.
Mobic's one of those too.
It is, but
It's like Cox too,
what's
so
the other
Cox
common
one.
one? Anyway, CNS stimulants, so central nervous system stimulants, that's your Ritalin, Dexedrine, things like that. CNS depressants are your barbiturates, and like Dilantin and things like that. Those are both controlled medications. Opium and opium alkaloids, like morphine, codeine, and Demerol, again controlled. Psychotherapeutic agents, Compazine, Valium, Ambien, they're tranquilizers and mood modifiers. Typically can't drive or operate heavy equipment. Skeletal muscle relaxants for like muscle spasms are Robaxin and Flexeril are the two most common. Cardiovascular agents, this is obviously for heart issues. Amyl nitrites or nitroglycerin. Vasoconstrictors, this is for your anaphylactic reactions like epinephrine and Afrin. Afrin is not for an anaphylactic reaction, but Afrin is what you can use up to 3 days to reduce swelling in your sinuses. Anticoagulants, prevents blood coagulation, and that's heparin therapy and Coumadin. So water-soluble versus fat-soluble vitamins. Know this. I don't know if it's still in the first class exam. I know it was on the third class exam a lot, second class exam sometimes. I don't remember it being on the first class exam except for maybe one question occasionally.
The B vitamins are what they like to ask
They
about.
love to ask about all the B vitamins because there's so many of them. So your A, D, E, and K are fat-soluble. Everything else is water-soluble. I came up with a ditty a long time ago to remember A, D, E, and K, but I don't remember what it was. Come up with something that helps you if you can't remember A, D, E, and K. So know that vitamin A is retinol, vitamin D is your sunshine vitamin, vitamin E is tocopherol, vitamin K is
Yes.
that one. Vitamin B1 is thiamine. I've seen that on a lot of tests. Vitamin B2 is riboflavin. That one was the most common one on the test. Vitamin B3 is niacin. B6 is pyridoxine hydrochloride. Vitamin B12 is cyanocobalamin. And vitamin C is your ascorbic acid. I've seen ascorbic acid on the test too. Know your vitamins. Classified anesthetics are classified as general or local. General, of course, is your entire body. Local is like when you get dental stuff done or whatever. So ketamine, fentanyl, novocaine, xylocaine, and lidocaine. Ketamine and fentanyl are general. Novocaine, xylocaine, and lidocaine are all local. Oxytocics, medications that produce a rhythmic contraction of the uterus, like Pitocin.
What's the standard anesthetic? It's a test question. What is the standard anesthetic? Correct.
Lidocaine. Yes. Ketamine we use on animals when we, typically cats, when we neuter them. Ketamine is also a date rape drug.
Giving people.
Just saying, that's what they use. Elixirs, aromatics, sweetened, hydroalcoholic solutions containing medicinal substances. Those are elixirs. Suspensions are coarse dispersions comprised of finely divided insoluble materials suspended in a liquid medium. The process of mixing or combining the ingredients to form a suspension is called reconstitution. I've seen suspensions and reconstitution on the exams. Ointments are semi-solid, fatty, or oily. Suppositories, I mean, it's a suppository, right? It can be rectal, vaginal, or urethral. Ouch on the urethral. Capsules, gelatin shells. So the difference between a capsule and a pill, right? The capsule has the gelatin shell. DoD prescription form is your DD form 1289. We did the second one already, right? We haven't done the third one?
Yeah.
I'll just give you all the answers. All right, DoD prescription form, know this form. This form only has how many prescriptions on it? 1. This form can only give you 1 medication. Parts of your prescription form, you need to know this. So, you have your patient information block, whatever, you don't need to know that. You have your medical facility and date block, sure. Your prescription block itself, your superscription is your prescription. That's the RX. That is the medication itself. Your inscription is the name and the quantity of the medication to be used. Your subscription is the directions to the compounder. So whoever's putting it together, like the amount that you need, right? The signa, not the prescriber's signature, but gives the directions for the patient. Signa is not signature. It's not an abbreviation for anything. Signa is the directions for the patient.
Take 2 QAM.
Right.
PRN.
Right. And then the prescriber's signature blocks at the bottom. This is what it is. And this is what it looks like. And this is what it has looked like for 750 years. It has not changed.
I guess it's Samuel Nelson's prescription right there, but that would be vulgar.
So, John Doe, HM3.
John Doe. at the USS Never Forgotten.
DD 178.
Yep, on the 23rd of June of 1999. All right, so now we're gonna match. We're gonna do a little matchy-matchy again. So match the parts of the prescription form to what they are. So what part of the prescription form where only one prescription, or what's the prescription form where only one prescription can be filled on it? The DD 1289. What is your RX? Superscription. Superscription is your RX. Remember, the RX is usually like little tiny letters in the top and then it has a circle around it? Mm-hmm. That's the superscription, right? Because it's above all the other words. You have your words here, and then you put RX up here. Just remember, superscription, that's where it's written, right? What is the directions for the patient?
Cigna.
Cigna. Cigna is the directions for the patient. Last name and quantity of medication to be used?
The inscription.
Inscription, yes. Gives directions to the compounder.
Subscription.
Subscription. And what is your polyscript form that we did not cover, but is
6710/6.
6710/6. Okay.
Sorry.
No, you're good. So what is the form number for the Navy's polyscript? Here, just the rest of it.
Yeah, this is next week. Sorry.
6710/6. No, you're fine. This is the rest of it, I think.
Okay, thank you.
How many prescriptions can be filled on this form that we were talking, on the polyscript form, I'm sorry? How? No, on the I apologize. On the polyscript form, what is the maximum amount of prescriptions that can be written on it?
I'll go with 3.
It is 4. It is 4. Up to 4 medications can be written on the 6710/6. On your DD 1289, only 1. Don't forget those. Those have been on the test. And know the form numbers. The DD 1289 is like on almost every test. Just like the prescription eyewear. If there's anything about optometry on the test, that's the number you need to know. 771. All right. Schedule 1. There's no acceptable medical use. Heroin. LSD, all of those things are medications with no medical use
Meth.
at all. Meth. Although we do use meth, it's called carboxone.
I mean,
Carboxone.
technically I take meth. Adderall.
And Adderall is meth. Methylphenidate. We count it in the freaking pharmacy all the time. It's just not the same. Okay. So Schedule 2, it's just smaller doses. It's the same. It's just we're paying for it.
Same, but different.
It's controlled-ish. All right, Schedule 2, high abuse potential, narcotics, barbiturates. That's your fentanyls. What he takes, no. So Schedule 3 is your Adderalls and stuff like that. It's a Schedule 3 medication. There's less abuse potential than a Schedule 2. But there is moderate dependence liability. So your stimulants, your depressants, and your anabolic steroids. Your Schedule 4 drugs are less abuse potential than Schedule 3 and have limited dependence liability, like Valium and Ambien and your general, like, my back hurts, I need something, kind of medications that are a little higher than Motrin. And then your Schedule 4, or Schedule 5, I apologize, your Schedule 5 are limited abuse potential, antitussives, antidiarrheals, antacids, things like that.
Great job.
Are there any questions?
No.
I only went over by a few minutes. No questions?
Get out.
Just kidding. You know you love me.
I never said I didn't.
All right. Is it lunch? It's lunch?
Is it lunch? Let's see.
Let's look at the.
1109.
Alright, where do we at? Alright, what do we got left?